Welcome back to the interview series on the socioeconomic consequences of disruptive technologies by rethinking economics now. In this interview today, we'll be focusing on this topic from the perspective of entrepreneurship, innovation policies, and enabling technologies. And for this, I'm honored to be able to introduce quite a few experts of the world's leading experts. Firstly with us today is Loubna Bouarfa, who is the founder and CEO of OKRA Technologies, an artificial intelligence data analytics company for healthcare. OKRA allows healthcare professionals to combine all their data in one place and generate actionable, evidence-based insights in real time to save and improve human lives. Loubna was also a member of the European high-level expert group on artificial intelligence, where she was particularly focused on healthcare and achieving competitive business impact with AI. She was named an MIT Technology Review Top Innovator Under 35s, at Forbes 50 Top Women in Tech, and won several prizes, including the CEO of the Year Award in 2019 at the Cambridge Independent Science and Technology Awards, and Best Female-Led Startup at the Startup Europe Awards. On a personal level, she is a strong advocate for diversity, women, and challenging the status quo. Also with us today is Yangbo too, a former academic turned entrepreneur, tries to lay walls and silos to enable and empower people, driving meaningful impact. He is a trained economist with a degree from the Massachusetts Institute of Technology and a starting block New York Social Innovation Fellow. From 2005 to 2011, he conducted research on topics in energy and environmental policy, covering biofuels, nuclear, and infrastructure in general. Since leaving academia, he has co-founded startups, international trade and development, digital media and online marketing, data and analytics, the Internet of Things, financial technology, and many other related fields. He is currently ramping his fifth batch of early-stage ventures, spanning across functions including blockchain-based artificial intelligence, transport telematics, and social capital and currency. Lastly with us today is Yonah Welker. They've been working on the intersection of tech and society since 2005, when they became a tech explorer and launched a hardware think tank. Over their journey, they founded and co-created tech startups and labs, helped to facilitate tech ecosystems through North America to APAC, MENA, Africa, Europe, and they screened over 2,000 teams, contributed to projects in ethics, such as data and AI and tech, deep tech, impact, and sustainability, especially at the European Commission. They guided and screened the world's youngest tech and AI inventors, Ahsoka and the United Nations Fellows. Talents from Google, Singularity University, 500 startups, Techstars, Mass Challenge, alumni of MIT, Harvard, Stanford, Oxford, women entrepreneurs, and leaders from the Opera Academy, WeDo, and the African Leadership Academy. And with that, I would like to go to the first question of today. And that is for Loubna first. Could you tell us more about OKRA Technologies, and especially how you apply artificial intelligence in a practical way to achieve a meaningful impact in healthcare?
Thank you, Koen. Thank you for the invitation. My pleasure to be here and share my experience with the students in economics and beyond. So OKRA is an AI company. We are based in Cambridge, UK, and Leiden, Holland. I founded OKRA in early 2016, and our key expertise is implementing AI in the pharmaceutical pipeline to drive innovative treatments faster to patients. So our goal is to speed the delivery. So once we have an innovative molecule, how can we bring it faster to patients regardless of where they live, regardless whether they are in rural or urban areas? We want all patients to be able to get those treatments faster. And as you said, next to our work with our clients, we are also driving the adoption of AI in Europe, advising European Commission and the member states on how we can be competitive in AI by driving the ethical implementation and the policy regulation. So before I tell you about AI in healthcare and specifically in pharmaceutical market, where we apply it at OKRA, let me tell you about this beautiful market. Now, we've been all, during this COVID pandemic, we got a bit closer to it because we are all waiting for vaccines. We've seen the steps and so on. So if you look at it, what is different about pharma than other industries? Currently, it costs on average nearly 2 billion to bring a drug to market. Part of the reason that number is so high is because every success also has to pay for many failures taken in the development of new drugs. So once this beautiful molecule is in the market, we actually spend even more money to validate it in clinical trials, to get it approved, and then onto sales and marketing to drive it to doctors. And even though we are not allowed to promote to customers directly, which is the patients, we still have to do a lot of activities to be able to educate doctors to start prescribing this treatment. So, which makes the profit to make, which makes the period for this industry to make profit is very short compared to other brands, because the patent expires in 10 years. So we've got a very small window. If you compare to FMCG, like the other brands, you have lifetime. So, if I see this, the value of these novel treatments, that in this short period of time, so many patients are waiting for those drugs to arrive to them, and they can't get it, either because it's not approved in their country, either because their doctor doesn't know about it. As an entrepreneur and data scientist, when I see a challenge like this, I ask myself, can we close the innovation gap and allow, in this small window of time, more patients to get access to these novel treatments, even prior to patent expiry, even in highly regulated European countries like Germany, like the UK? Do I think AI has a role to play? Oh, yes. I see that we can speed up that process. So let me share with you how we do that. So if you look to the pharmaceutical pipeline, when a lot of AI companies are focused on the R&D side on the left of the pipeline. So how can we use AI to discover new molecules and treatments? AI is used literally like a computer to sort and design hundreds of different molecules and look for their potential for life far more than a human can do in the classical setting. But the opportunity on the right side of the pipeline, once this molecule is designed, is huge, because it is designed and sometimes it doesn't reach the patient on time. And at OKRA, that's exactly where we focus on the industry itself. Once it's there, that molecule, how can we bring it faster? So we have products, AI products, that's specifically designed for different stages of the drug life cycle, post-development. So OKRA's products support life science stakeholders to take charge of what needs to be communicated to regulators, to payers, to doctors, in order to bring this drug faster to the patients in need. And if you look at it from a perspective, why is communication in such ecosystems so difficult? It's highly regulated. First, you have the patient is in the center. But of course, every stakeholder is in a tunnel vision. They are looking into their own incentives. Doctors want to cure the patients. Payers want to, manage and make drugs more cost effective. And regulators want to make sure that drugs are safe and so on. And that's great. But sometimes in all this communication, the patient's needs are lost. So how can we make sure that we don't forget about the patient in this picture? And that's where we use AI. It learns from thousands of data sets, from public domain data, from clinical trials, from publications, but also data that is coming from our clients themselves, their interactions with those investigators, with those doctors, and from the historical submissions. And it is able to derive the right message that needs to be communicated, the right target population for those drugs, either in that country, either in that practice, so that we don't forget about the patient and we can bring those drugs much, much faster. And as you mentioned, the heart of our AI is the ethical guidelines, which I was part of in designing those guidelines 2 years ago for a period of 2 years with the European Commission, that needs to be human-centric. So the AI we design is not replacing human beings, it's providing suggestions, messages, deriving intelligence for the users. It empowers the people, the users of our products. It doesn't bypass them. It also, the robustness is very important to make those systems robust, safe, and fully respect the privacy and the data governance, because as you know, we're in a very regulated space. Data needs to be anonymized and identifiable. And we have a very clear mechanism to be transparent at OKRA. For every prediction we give, for every suggestion, we already also derive a reason why the AI system give that specific suggestion. So once you give a reason, people that use those AI systems feel empowered and they understand where it is coming from. And of course, to ensure the fairness of the system and to reduce bias, because eliminating bias is very hard in this space, we ensure that we have a diverse team of 15 nationalities working together, multidisciplinary teams, red teams that test those systems and make sure they are not biased towards different population groups, different users, and it is deployed in an environment that is safe for our users and user-friendly, that we can empower them to do their job in the right way. So this is how we use AI at OKRA.
I think that's really fascinating. And could you also expand a bit more on the entrepreneurial aspects? Because I can imagine it must be really, really difficult to be an entrepreneur and actually using these technologies. So what are some of the main challenges and opportunities? How did you roll into that, so to say?
So as an entrepreneur, for me, working in healthcare and the edge between healthcare and AI, because as I'm a machine learning scientist by background, in academia, I worked and designed novel algorithms published in high profile journals. That was not satisfying enough for me. It was great that we can publish about this novel, but what? How can we add value and impact? And what really intrigued me when I looked to the big tech platforms, which is, let's be honest here, not in high impactful sites, it's more social media or other companies. Scale is the term that I missed. How can we design scale? How can we bring scale to the algorithms we design so that they can have an impact? And if you look to healthcare, I worked in my PhD with surgeons and designed AI for the operating theater. And what I really liked is you're there, I'm in the operating room, I see the patients, it's very satisfying. But if you look to the scale, the largest hospitals in Europe, maybe around 3,000 patients, and you need to design one system there, the scale is still a question mark. What really intrigued me about pharma and life science sector is the scale. So one treatment, one drug, one pill, how many millions of patients are taking that pill to get better? So if we can design an AI brain that can drive this pill to the right people in this planet, we're gonna impact a lot of lives. Not only we're gonna save lives, but also we're gonna save a lot of resources, and we're gonna shift the economy. And this is because this is the platform to talk economy. We're gonna shift the economy from paying for the pill to paying for the outcome, from getting better. And that's what we want to aim for in this industry. So moving from a volume-driven economy to a value and outcome-driven economy, it's the dream. And when, as an entrepreneur, as a data scientist, when I see that AI and the flexibility of those algorithms, the accuracy that we can achieve, that it can add a lot of value here to achieve the scale and change the economy in this industry, and not only making healthcare affordable because we're going to reduce a lot of resources, but we're going to make it more accurate and more individualized once we know to which patients we need to be prescribing this pill. And that's what really intrigued me, and the way it started. What has been difficult is always the mindset. It's never so number one, change in mindset, but I see it as part of the job. You need to change the mindset of clients, stakeholders, and the second big obstacle is data. the lack of data. Data has been collected in this space not to train AI system. It's been collected for transactional purposes, for claims by payers. It's been collected for workflow purposes, like for electronic medical records. It's never been collected to train AI, except if you are more in diagnostic and imaging, where you have very specific queries. So how can we first get that data, which the privacy of it and the sensitivity makes it very hard, especially in Europe, the lack of data, and even if you get data, the amount of work that goes into translating it to a shape that can train an AI system. But for every challenge, as an entrepreneur, you see it as part of the job to deal with it, and you take it on board, and that's what we are doing.
And to make sure that before we move towards the other panelists, because I believe you have to go not too long, so we always have the same closing question to panelists when we at the end of the interview. But to ask you it already, so make sure that we still had a chance to ask that. So if there's one thing you could say to students related to the topics which you mentioned, what will that be? What do you think is the main thing, that's the main message that students should take away from that in economics?
I think if you are working in economics, and AI is the technology that drives the fourth industrial revolution. It's in the heart of economics. If you see the challenges that our world is facing, from sustainability to healthcare, poverty, and all the challenges that we want to solve, climate and so on. Technology could be AI could be the drive here to change the equation. As so far technology has been affecting or impacting those matters that we care to create more more problems for the climate. We created more inequality in our society, but now is in the fourth industrial revolution, where techniques like AI and machine learning, where we can be more individualized, where we can change the economy from volume-based to value-based to outcome-driven. That's the time we can change. We can meet both, and profits, as well as meet our goals, the SDGs, for example. And I think if you are working in economics, you are part of this fourth industrial revolution, and thinking about how we can use this technology to drive the change to meet those goals, because profit is not only measured now in terms of numbers, it's measured also how much we achieve in all the other on climate, on health, and other sectors. So having and also orchestrating all those variables in your domain of expertise is very important, and not to be left only for engineers that build those algorithms, but also to drive the thinking force from ethicists and economists and all the other disciplines to make a better world.
I think that's a beautiful answer. Thank you. Yangbo, you've also founded a lot of companies related to artificial intelligence and other disruptive technologies. Could you tell us a bit more about that? How does that relate to Loubna's experience as an entrepreneur?
Well, fundamentally, a lot of really this technology, all of this focus around artificial intelligence, and name whichever emerging technology where I've noticed it's a good reason why I've actually pulled back quite dramatically, and not all of a sudden, but over the course of the last few years from the pure tech space overall, is that so much of what goes on with these technologies has been, I'd say, if there's a way to characterize it, rather ignorant of the broader context around it, just thinking that by deploying this technology, we're going to be able to solve these and these issues, whereas until you get around to solving at least the managerial, organizational, if not the political matters around these issues, then honestly no amount of technology you throw at the problem can really solve it. And for the attempts that are taken to do it, you get examples as in, if you take electronic health records, for example, as Loubna mentioned, that they were promised as a cost savings tool, and yet at the same time, especially here in the United States, that very quickly within the last decade, they've become one of the biggest cost objects in the healthcare sector. Like what was promised to save time and money end up creating additional complications and complexities in the overall organizational workflow. So the real approach is that if you have any challenge, first figure out what are the organizational, the managerial, the political, the governance related aspects of it. And if you can solve those issues, then that's where you get to the point where technology can really help you with that, since it only works as well as you have the governance, the organization, and the political will set down.
And could you expand a bit more of the role of economists in that?
Well, first is, as having been in economics for over a decade since I left academic economics for a number of good reasons, but just looking back on it and tracing how discussions around economics have evolved over the past decade, is that on a fundamental level, for as far as economics go, you really have to pivot from the view where, because my experience of it was that if something didn't really fit your model, your conception, your assumptions, then the tendency had been to try to shoehorn whatever you observe into whatever presumptive model you had, whereas the shift has to be, well, assume that these models do not necessarily explain ex ante. They can only explain ex post, things like revealed preferences or such. By definition, they're only ex post. You never know until someone has expressed their preferences based on their actual decisions that, yes, these are indeed their preferences. So there's no way you can use to do any forecasting, any of that right there. But what it has to do is actually take an approach that basically accept that it's not something like physics, just accept that it is indeed a social science that is very much as dependent on the human factors as any other of the other social sciences, like psychology, like sociology, like all of these others.
And Yonah, how does this relate to your experience working on these technologies and such over the last decades?
Yes, it's a very good question. One of the biggest problem of my life is that I'm a generalist and I'm not able to be focused on building technology, but trying to connect different dots. I started my journey in 2005 and I've been completely passionate about technology, hardware. Basically, I was been kind of a technology scout. I had no idea about the term startup, but basically I was a startup scout. At the same time, I was researcher and journalist. And in this way, I came up with my first entrepreneurial journey. And after that, I became passionate about art and music. And through artistic journey, I became passionate about data science because I've used MySpace and social networks in order to promote my art, and I became really interested how we can use technology in order to make experiences more personalized, more human-centered. And after that, I spent many years experimenting with different startups. And at some point, I realized that we can use this technology not just for some kind of entertainment or media or content. We're actually able to use it for healthcare and education. I face serious health issues in my life. And I would say when I was younger, I was pretty naive in terms of how I see science and technology. I believe that we're actually able to treat cancer with more funding, for instance, or more progress just in maybe in the next decade. But more I deal with technology, I realize it's very complex and it's much more difficult. And that's why if you check my work today, is it completely, let's say, decentralized, but at the same time, it's very complex. Because on the one hand, I try to accumulate early stage ventures, and not only through ecosystems like 500 startups, like INSEAD or European Commission. We spend hackathons with guys like you and trying to find them from up to the bottom. So, and because it's really difficult to find talent in health and science, because unfortunately, and I had talked with one guy with PhD, and he said many people who became PhD were not really passionate about the topic because they're not able to take these risks in order to become entrepreneurs. But at the same time, people who jump to entrepreneurial journey, they lack some theoretic knowledge, and they have some kind of disproportion, isolation of academia world and entrepreneurial world. I was, due to my neurological disorder, I was a kind of a self-learner. And I always dream about being a part of INSEAD, MIT, Harvard. And I've been the whole way to demonstrate that autistic people, dyslexic people, able to become a part of this ecosystem through completely different door, not from examination, but through winning competition, through becoming mentors, judges, being a part of some significant paperwork or scientific work. It was extremely challenging, but that's how I became of a vision, which I called algorithmic diversity. Because if we talk about algorithmic diversity in AI in very narrow way, it's just about, let's say, assistive technology for dyslexia, social robots for autism, or smart glasses in order to recognize emotions of your mom, because children with autism are not able to recognize them. So we need to use augmented reality in your smart glasses in order to do it. But from a more holistic perspective, I see algorithmic diversity and philosophy. Algorithmic diversity is a complex economic vision, where on one hand, I see a significant disconnection between AI and data science teams and social science studies, gender studies, cultural studies. Just for instance, a few days ago, I spent a lecture in Colorado school. Almost all of the guys are male, wild male, for instance, and they will create a technology for women, but they have no idea about women's health, and they will come up with criteria, keywords for machine learning, which we put into technology. Like, I think with women is associated with a pink and flowers. It's a keywords. And after that, we come up with some kind of filter bubble of technology, not relevant personalization or not relevant algorithms. For sure, is a oversimplified, but was what I see. My first education in history, and I see what today we see a dominance of a, let's say, vision that we focus on technology like a data science, engineering, and people who have education in liberal arts, which should just become, let's say, addition to this ecosystem, to this vertical, like growth hackers, maybe product managers, product directors. They not consider it as a source of a social studies knowledge, as a source of a statistics, as a source of a cultural African Asian studies, in order to put this data into train, it help to come up with a more accurate training data. No, we ignore it. So, for instance, recently, I worked on the human-centered AI ethics project for European Commission. It was funded by European Commission. And actually, it was focused on building ethical frameworks for companies like Siemens, Bosch, and it will be integrated soon. But my idea was to come up with the vision of organizations as ecosystems, where we not only integrate, for instance, ethics professionals who help AI engineers to design stuff. No, we actually turn the whole ecosystem into organization where anyone is aware of bioethics, human rights, consequences of bias, and we create so-called accessible moral vocabulary. So we actually reshape how we see a technology company. It's not just, let's say, a developers department, design department, marketing, sales, and we just trying to come up with the so-called human-centered design. Nope, it's not human-centered design. It's just built across some quick customer requirements. Customer and human, it's not the same. Human is an individual, is a biological one, is a citizen. There are much more different criteria, and you completely ignore it. You just ask about what kind of a screen you like, colors you like. I mean, it's not a user research. For instance, we spent sessions in 500s of startups, and one of the key reasons why early stage startup fail is a lack of research. I mean, in most cases, startups try to spend money on growth hacking, on active scaling, but they completely ignore user research, interviews, using it in a very quality way, in a very smart way. And it's very funny, but many people today trying to build health technology not being very good in healthcare, in medicine. I mean, today we have a really kind of we overwhelmed by buzzword. Anyone is about AI today, even though you're just a startup who use some data sets. So now you're AI. And if you are able to measure my heart rate, you health tech. Guys, it's not health tech and it's not AI. I mean, it's just simple app who use some data. There is no artificial intelligence. We're not about singularity currently. And is it not about health? And second problem I explored and when I work on algorithmic diversity is a lack of representation. Currently, I lead the expansion of women in AI in the United States. And also we plan projects in APAC in Australia. And we call our upcoming hackathon Zero Exclusion, because when we talked to my co-founder, she said, and we were completely agree about this, we don't like the term inclusion because we have, let's say, some kind of vertical, which were created by the same type of mind. And afterward, we just try to feed other people who are completely different. So we never ask them about how was classroom or ecosystem relevant for them before. We already created it as we see it and just try to push them. Instead, we trying to be focused on zero exclusion. So trying to create a completely decentralized ecosystem driven by small teams, focus on particular type of problems. For instance, we're trying to align African-driven teams with the knowledge in African studies in particular audience. And we try to combine knowledge in AI technology and data science is actually with natural gender and cultural studies, African studies, and we try to bring into hackathons. So our goal is to reshape this vision. At the same time, people ask me sometimes, women in AI. So we need events like this in order to involve more women. It's not correct. It's not correct. Our logic is completely different. Our goal is not to involve more women. Our goal is to demonstrate that we can create an ecosystem with different minds. This hackathon was created by women, not for women. For instance, we actually open to any gender. So in Accelerator Program, we have males, but the idea what we try to build the whole principle of acceleration in a bit different way in terms of the topics and so on. For instance, I follow the most successful MIT startup for many years, and I've seen how many great teams focus on health, neuroscience, neurological disorders. They fail. We've never been able to get funding because they never fit so-called Y Combinator or 500 startups metrics in terms of the growth, in terms of the money they need. So we had some kind of a verticals of venture capital with particular type of focus metrics. And afterward, we just try to expand this vision everywhere in APAC and Africa. And afterward, we see the same funnel again. And some types of companies, types of topics where they always underrepresented. And that's why 90% of the people with autism are not employed. Almost every assistive technology device or company not able to get funding. We have only one disability accelerator in the world in Australia, even not in UK or US, in Australia, because it's funded by Australian government. And we have another, let's say, ecosystem would help people with disability is Europe and European Commission. So for instance, recently we work with ISDI program, and I guided team focused on AI for dyslexia. It was focused on eye tracking for young kids in order to improve reading skills. But at the same time, in UK, I'm a part of disability working group. We have only 15 members. I mean, it's very small. And US just is becoming a part of this movement. It was behind this movement many years. So it has the biggest venture capital, and many times bigger than any other venture capital ecosystem in the world. But at the same time, it completely ignored many fields. And it's not just about disability, it's about many type of products focused on women, education, social service, smart cities, and so on. And that's why, if you would love to explore smart cities, you go not to the US, you go to the Singapore. If you would love to see the best examples of education, you go to the Finland. When we explore the most progressive countries in terms of a dyslexia technology, it's actually Nordic countries like Denmark. Interesting enough that even Germany is behind. So even though we have a bigger GDP and some economic numbers, but at the same time, they're not so progressive. And another thing what I'm really focused on is a policy. So as I mentioned before, recently I come up with the human-centered AI ethics protocol, but at the same time, I'm continuing my research focus on human rights, because before we talk about, let's say, ethical issues, and when your data privacy or safety is interrupted, but we never talk about why it's crucial. We never talk about that it's because your human rights are interrupted. It's because we are citizens. And once I had a talk with the founders of Wikipedia library, and we talk about evolution of vision of the user into digital citizen or internet citizen. Then anyone know their rights. We own our data. We own our privacy. We own our ability to protect our children. And that's why I try to connect, for instance, people who work in order to make AI technologies more safe in terms of safer in terms of to protect children from cyberbullying, harassment, and other stuff. For instance, only in 2020, UNICEF came up with a framework which is called AI in children. We never had anything before. So young people are the key audience who spend their time on YouTube, social media. They're the main consumers of content, of different smart toys. We build a social robots for them, but we never had any actual policy for that. So it's actually just the beginning. So on one hand, our goal is to reshape venture capital in terms of a more niche products. Second is to reshape representation, but more importantly, connection, not just representation of some abstract people we put, like we need 5% of Black people, 5% of Asian. No, it's about cultural, cognitive representation, and actually putting this knowledge into the workplace in terms of bioethics, human rights, and all of this knowledge in order to build this ecosystem. And finally, is policies. So yeah, it's a very complex thing. I mean, I'm overwhelmed almost every day, because on the one hand, we came up with some solutions, but at the same time, new threats occur just another day. It's a very interesting because we are forced to connect different dots. As I mentioned before, we need to learn from Australia how to build disability accelerators. We learn from Europe how to leverage public funding. And next, we learn from United States how to make it big. Finally, United States became a part of this movement recently. One of my colleagues there, she's a venture capitalist, and she started the platform which exclusively invests in autism technology. And also we have a Vanderbilt university, and they built a neurodiversity technology center in order to be focused on technology transfer in this field. So we become a part of this movement. as well. But at the same time, I'm still pretty depressive. I mean, tons of stuff should be done. Only one of 10 people actually have an access to this technology. So though you will be able to see it on conferences, on YouTube, robots, bionic limbs, and other stuff, it's not so accessible. And it's still pretty limited. We need more and more companies. I had talked with social robots a team from United States, and the founder said, we don't consider our competitors as competitors because this market is so empty. We need more people who build similar stuff in order to attract attention of venture capital, scientists, researchers, innovators, hackathons, and build this market because it almost doesn't exist. There are a few teams in the US, few teams in Europe. I spent podcasts with both of them, both teams on Bootstrap. They're not able to attract venture funding. So either we use the own resources or crowdfunding. So it's very challenging. So then people say, oh, cool, we have some accessibility programs in Microsoft. We have a Google Glass who collaborate with the smart autism-focused glasses, or we have a robots at school. I mean, it's still more kind of theory. We have just a few teams who do their best in order to promote this technology. It's extremely challenging. They're not unicorns. They're not even zebras. They're just small teams of a few people who actually push this agenda forward, but it's extremely challenging.
I think it's really fascinating. And I think I had a lot of teams that I think Yangbo is also focused on. So I was very curious, how does this relate to your experience and how does it end your ideas?
First, a lot of the concerns about scaling and such, where it actually is, where I see somewhat of some of this arguments missing the mark is there's still a lot of fixation at the moment on going after quote unquote hockey stick type growth and the unicorns and all of that. And of course, there have been more constructive developments like zebras, for example, but it's come to attention not too long ago that even just by definition, if you think of unicorn and such, that just by definition, it's a rather exclusionary concept, because what would you think would be more equitable? You have a couple hundred billionaires, for example, if you take a unicorn approach versus a couple of million millionaires as opposed. So which one do you think will actually lead to much broader based prosperity? And you can definitely see it play out if you ever even take any cursory dive into contemporary economic trends around the world. So that's partly where I could see that the narrative, that the conversation will have to shift to one that is a lot more equalizing, as opposed to seeing a market as something to dominate, to be able to compete at the expense of everyone else. So I think Uber or any of those heavily funded firms. And on the other hand, if you think of the markets as in, well, if you're trying to get into the market, well, who is there you can partner with? Because chances are that there's already plenty of innovation on the ground as market. And also with innovation, it's really critical to see innovation not from the excessively technocratic or tech-centric approach, but rather see innovation as very much a ground-up process, regardless of what your technological base is. That go anywhere, no matter where you go, and as long as you know what to look for, as long as you are willing to let those who have that tacit knowledge on the ground to lead the way, you're going to find the innovation. And see it as also to bring up where much of this conversation is also needs to shift is this notion of knowledge transfer whenever emerging or frontier markets get brought up, because with any of those relationships, it's always an exchange. It's never a one-way transfer. It's already presuming that if you're from, for example, Europe, United States, other developed countries, that it's they who need to learn from you. Whereas on the other hand, it's chances are that you might actually do very well to learn from those you're purporting to serve in less developed regions, because they have a lot of innovation that's taking place that is specific to their context that maybe you're not aware of because you were never privy to that type of context firsthand. So it's always about emphasizing a two-way exchange when it comes to innovation, and really shifting this narrative of how do we grow companies? How do companies scale? How do we expand into other markets? That's something that needs to change from a hegemonic to a non-hegemonic point of view.
Yonah, what is your thinking on this?
Yes, I completely agree. And one of my recent researchers and series even called decolonization of AI, and another meaning behind it is actually fighting not only colonies but monopolies first. I mean, one of the biggest troubles and problems I've seen in my technology career is the obsession on building monopolies. There is a term of blue ocean. Basically, it's focused not only on finding your narrow niche, but becoming huge as soon as possible in order to acquire other companies. And when I've been involved in building data companies, almost all in our teams, our investors were upset with the idea to sell our company as soon as possible. So the whole mechanism is created in the way with defeat this monster called Google, Twitter, Amazon, or Microsoft. So we have a vertical which we constantly fill with another startup which sell them data or access to particular markets. So in this way, Facebook already actually not only dominates social networks market, but also markets focused on social advertising. So they actually accumulate the power of whole vertical that help them to make money. And the problem is that it's not only about your mindset, it's about how this market currently works. So if you would love to attract money, you should share this mindset, or nobody will invest in you. So it's not just about being fair or not. I mean, it's really difficult to be not upset with acquisitions, unicorns, and attract money in the United States. I mean, I talked with many VCs, and they share this mindset, and they openly talk it to me. For instance, there is an acceleration program called Entrepreneur First. And it's a very interesting example because they outcompete 500s in terms of a recent round. So 500s, though this program exists many years, they struggle to attract $50 million. But at the same time, Entrepreneur First is a relatively new acceleration program from UK. They attracted $130 million. And they grow very quickly because they quickly understand that we have idea to quickly build the team from two scientifically driven founders with PhD. And after that, they sell these teams to existing tech giants like Twitter. So basically, we sell them technology in talent. So it's a kind of the quick funnel of product development, talent sourcing for big companies. So is the whole market built across around this logic, and it's not so easy to change it. I mean, once again, I talked to many companies who build robots, who build AI for good, for health, for education. They go to the VCs, they go to the impact investors. And the question is, where money? How I make money on you? How I get my output? Okay, I'm okay with making impact and being sustainable, but once again, we should be feasible. in the end, we should be feasible and sustainable from financial perspective. And the problem is the market exists in the way, which is it's really challenging. And that's why we ever go, for instance, Women in AI is a nonprofit, and we work in decentralized way. I start to experiment with decentralization, with different type of volunteering engagement, crypto and other stuff. It happens not because people are so passionate about crypto, but because venture capital doesn't work. In order to fuel many existing technology needs, we actually require. I'm a patient. I'm a used medicine from 1960, and I never seen any new medicine in my field related to mental health, because in most cases, companies focus on building another pharma, which help them to make more money, having big advertisement, but without actual help for people with severe issues. So actually, we use the same old stuff from the past. And that's the state of a business we have. I mean, until we reshape the whole capitalism, until we reshape all of the organization funds, which involves in this mechanism, it's really difficult to change it. For instance, as I mentioned, recently, one of my colleagues who focus on autism, she created a fund which exclusively invests in autism, not because it's easy. I'm sure it's very challenging to make it sustainable, but because she's a mother, but because she faced this trouble in her own personal life. And then I had a talk with another woman who focused on disability center, and she said, no, it's not feasible. I mean, I'm really spend all of efforts in order to make it feasible, but it's extremely challenging. But I'm a mother, and my son disabled, and I would love to help community. I mean, they're activists. I mean, when you talk about assistive technology, it's still activism. It's almost impossible to make it even feasible. I don't talk about unicorns. I mean, I would love maybe to see some unicorns in this field. For instance, a startup called Ultranodes, they focus on connection of autistic people with big tech companies. They attracted $3 million. It's a kind of a huge round for this market, just a huge. But basically, it's still very challenging for all of us. But I really believe in the power of diversity of capital, and it's actually as a part of my work, because along with the portfolios I collect, we work with the existing ecosystems, like 500s, Inset. I'm always trying to be involved in so-called experimental ventures. For instance, I'm evangelist of unit ventures. They focus on stakeholders economy, and I'm still experimenting with the non-venture approaches. Sometimes I become a part of a venture fund or not venture funds who use new models. So there are still so many experiments, but most of them are not super successful. So venture capital are not ideal, but what's what we have in terms of funding of big rounds for pharma, health technology. So we either need support of government, of a corporation. So that's why, for instance, 500s actively build verticals with the corporations. Techstars created CDAR, Sinai Health Tech Accelerator in the United States. So it's really difficult just to go away from existing model just because resources are accumulated in some monopolies or some kind of centers of power, and more competition we have, more chances to improve it, and what's part of my work as well.
I think that's really, really interesting, but I'd love to go into that further, but we're already quite close to time. So as I also said when Loubna had to leave, is that we always have the same question about this series. And that is, just one thing you could say, just one thing that you want economists to take away from this, what will that be, students in economics and such? And I think it makes most sense to do to Yangbo and then Yonah, and I think that after that we have to close. So Yangbo, what would be for you the one thing you want to say to them?
Well, as the first thing to consider, of course, as I reiterated earlier, is to focus on the human side of matters, especially given that often how economics in the second half of the 20th century had been a practice. It was very much an attempt to mimic physics and the physical sciences, and we know quite clear that that's far from the reality of the situation. So basically accepting that, just be willing to accept that you're dealing with complexity, you're dealing with things that you're not going to be able to foresee in advance, you're dealing with things that generally that may get you in a state of cognitive dissonance once another. And it's also accepting that in general, that if something doesn't conform to your model, go back to your model as opposed to try to shoehorn. Just go back to your model, see if your model's wrong, because chances are, and also furthermore, it relates to not just for economics, but also for all innovations, is that if you apparently come up with something that looks like some type of a breakthrough, do a couple of sanity checks, go through past records, even decades past. Has there been additional other attempts in the past at similar questions you're trying to address? Because chances are that either you're the one who made a mistake in that, or its chances or you're just the one being solipsistic, or the others, they were all wrong that came before you, and 9 times out of 10 chances are that you're the solipsistic one. It's not those others who've come before you. So do be sure to really don't overlook the importance of what has been done prior, what has been tried, what were lessons learned then, so you don't repeat those same mistakes as those who come before you.
I think that's fantastic advice. Yonah, if there's one thing you could say to students in economics which you want them to take away from this conversation, what would that be?
Yes, it's not one, but it's a very quick answer anyway. First of all, is rethinking the key criteria and metric of the economy from GDP and money to the freedom. I believe more freedom we have, more potential to innovate we have. Second is to go in from inclusion to zero exclusion, and from one fits all to one fits one design, and creation around it, the mechanism which just exclude any kind of monopoly, no matter economic or monopoly of thinking.
I think that's a beautiful answer as well, and very, very compatible. I want to thank the both of you for your time, and of course, Loubna as well. And we hope to see the viewers as well for the next episode. Thank you.
Thank you so much. It was a pleasure for me.